For this case, I'm working with an axial CT scan of the chest, focusing on the right apical region. As I assess the imaging, I immediately notice a large rounded mass in the right lung apex. This region is quite distinct and concerning, especially considering its size and the fact that it causes clear bony destruction of the adjacent rib, specifically the third right rib. Such findings in the apex of the lung should raise a red flag for a superior sulcus tumor or, as we commonly know it, a Pancoast tumor. This is crucial because Pancoast tumors often involve nearby structures, such as the brachial plexus and sympathetic chain, leading to a constellation of clinical symptoms, including Horner's syndrome. Now, coming back to the CT scan, the bone window setting really helps highlight the erosion of the rib, which makes it highly unlikely that this is a benign lesion like a pleural plaque or apical thickening. Benign processes don't typically cause this degree of destruction. The mass is also unilateral, which makes it less likely to be something like bilateral apical fibrosis, seen with chronic infections like tuberculosis. Infection can cause similar features, but you wouldn't expect to see bone erosion so prominently with infections alone. Given the location, size, and extent of this mass, especially with the involvement of the surrounding bone structures, malignancy is top of my differential. A Pancoast tumor is almost always a non-small cell lung cancer, and it's known for its aggressive local invasion. Now, something to keep in mind for the viewers. While CT scans are excellent for identifying the bony destruction and the mass itself, an MRI would be better for evaluating soft tissue extension and involvement of the brachial plexus or vascular structures. That's something I would suggest as the next step in staging and planning for treatment. It's important to also consider possible metastatic spread in such aggressive cancers. Although no evidence of mediastinal or hilar lymphadenopathy is apparent on this CT, it would be prudent to perform further imaging, including a PET CT scan, to rule out distant metastases. The anticipated questions the examiner may ask could revolve around your differential diagnosis and how you'd proceed in terms of further imaging. For example, they might inquire about whether an infection like tuberculosis or an alternative malignancy could present similarly. You'd emphasize that the presence of rib destruction and the mass's characteristics strongly favor malignancy, making benign causes or infections less likely. In summary, the findings on this CT scan, combined with the clinical context of right arm or brachial plexus symptoms, make a Pancoast tumor the most likely diagnosis. This is a challenging case where urgent multidisciplinary management is required, including referral to oncology and thoracic surgery for staging and treatment planning. MRI and possibly PET CT should be used to fully assess the extent of the disease. Stay tuned for more radiology cases, and if you want to dive deeper into more cases like this, subscribe to Radiology Made Easy.